Okay, hi, I'm Dr. Bardia Anvar from Skilled Wound Care. Today I'm here with Dr. Alexander King, and I'd like to welcome him. Thanks for coming on our podcast, Dr. King.
Yeah, thanks for having me on. I really appreciate the opportunity to talk about what I do.
Great. Do you want to just start off telling us a little bit about yourself and what field of healthcare you're in?
Sure. I am from Virginia originally, and then went to college in Pennsylvania in Allentown, called Muhlenberg College, double majored in neuroscience and sculpture, and then applied to both MD and DO schools after graduation, and then interviewed and was accepted at the Philadelphia College of Osteopathic Medicine, which is where I went for 4 years, and then finishing up my residency in Osteopathic Manipulative Medicine at the same Osteopathic College, and it's a 3-year program, so I'm finishing up my last year right now.
How does it feel to be in your last year of training?
It is a long road, but I am glad it's finishing up. I feel pretty ready to, have my own patients and just to start practicing, so I'm pretty excited.
For those who don't know, what is it specifically that your field does for patients?
So my field is a specialty field, probably one of the smallest ones actually that exists in medicine right now in the United States. We do osteopathic manipulation, which means we look at everyone's body in a very holistic manner, meaning we look for any asymmetries, any tissue texture abnormalities, if they've got, back pain, neck pain, even chronic migraine. I've also been trained in pediatric and infant manipulation techniques. So I treat a lot of infants who have trouble feeding, who either have misshapen heads from the birthing process or just have really tight muscles from that same process. So I treat babies, peds, older individuals with arthritis. So my field is pretty wide, and we really focus on mostly musculoskeletal conditions. I've learned tons of various hands-on techniques to try and fix those symptoms.
Oh, wow. For example, a child that's not feeding well, or I guess a colicky baby, what are some things that you could do for them?
So we would use a very gentle set of techniques, obviously nothing really chiropractic and, doing an impulse to mobilize certain vertebrae necessarily, but we're looking at the whole child in a, whole body manner. So I'll check the hips, the back, the spine, the skull and cranium, and then the upper back and neck. Typically, infants who aren't feeding too well have what we call condylar compression, which is where the occiput, the bones of the occiput are kind of compressed from that head extension during their birth. So those nerves that exit the skull kind of become pinched under there, and we work to release those tissues in a pretty gentle manner, and we'll have them come in, once every week or two just to follow up. And after a few sessions, typically their suck is better, their latch, and they are less colicky, sleep better, eat better. So yeah, that's kind of how we would approach it.
Well, that's pretty interesting, because I have 3 children of my own, and I never knew if this was even an option in pediatrics.
Yeah, kids respond great. Their tissues work. They're pretty pliable and more elastic than chronic kind of pains and
Right.
chronic tissue changes. So yeah, we do a lot of pediatric. We actually have a pediatrician who did a OMM fellowship at PCOM, and she does manipulation and not peds management, but she subspecializes in pediatric manipulation. So I've learned everything under her. So yeah, we've got a very diverse faculty, so it's good.
Going back, I think you said you grew up in Virginia. When was the day you knew that you wanted to become a physician and go into medicine?
I think it all started when I was very young. My mother's side of the family A lot of them are physicians. My grandfather was an herbal medicine and acupuncturist in Korea. And then my mom immigrated here after medical school to do her residency in child psychiatry at the University of Maryland. Practiced in DC while I was growing up. And, I initially actually the first thing I wanted to be was an architect. I have, a lot of interest in design and art. And eventually, I think in middle school is when I really got into science and wanted to learn more about, health and the human body, and really the architecture of the body itself really intrigued me. So, I think about middle school is when I kind of decided I wanted to be a physician like my mom and like a lot of my relatives. It was a big influence of mine for sure.
And of all the specialties, why did you choose manipulative medicine for your training?
I think for me, it was the perfect combination of art and science in a way that, I could use my skills in sculpture of almost sculpting the body back to health. Like, I love surgery. I like my surgery rotations, but I wasn't so much drawn to the lifestyle of the surgeon and that you're always in the OR. It's a lot more stressful. I like the outpatient setting and wanted to I was thinking about physiatry actually, but I wanted to just do more, just pure hands-on injections or things like that.
Yeah, I mean, as a surgeon myself, I can attest to the grueling hours of surgery, and going through the training is it's pretty rigorous. And I think a lot of times we think like surgery is the end all and be all of what we can do, but we can get a lot of great results for patients by a lot of different methods, and somewhat the standard that we always think of is not always the best for every patient. So I commend you on really bringing this to the forefront for everyone. As it relates to us as at Skilled Wound Care, we see a lot of elderly patients in the nursing facility, a lot of pain issues. We see contractures from dementia, patients having a lot of pain with wounds. Is there anything that, from your point of view, we could be doing that could be helpful to our patients?
I think what's interesting is, after a wound has healed and the process of scar formation and how down the line, those scars can lead to a lot of symptoms that people don't realize necessarily. I'm also being trained in medical acupuncture and doing a lot of scar work with really fine acupuncture needles can help release the fibrotic tissue that develops even underneath the scar. It's almost just looking at the tip of an iceberg when you see a scar, because it actually goes a lot of times, as deeper into those tissues from the surgical procedure. So I actually think, a lot of patients could benefit from treatments of the scar itself after that process. And also, I'm often consulted on an inpatient basis post-surgery. So, the patients will have ileus a lot of the time because their sympathetics are really high. And I'm helping to calm that fight or flight mechanism by, releasing the back of their neck, their upper back, things that are really tight and causing a lot of facilitation of those sympathetic nerves under the ribs. So I think there's a lot in terms of just mobilizing tissue after surgery and then monitoring those chronic tissue changes down, years down the road.
Once we see a wound heal, we kind of walk away, but a lot of patients are still at risk after even their wounds heal of redeveloping a wound in the exact same spot because the tissues are not as strong as they used to be. You talked about something else that's interesting to me is the stress and the tension that's held in the neck and the shoulders. For nurses out there who are working in nursing homes or in the hospital, they're on their feet all day, they're going around and seeing patients, maybe they're developing neck pain or shoulder pain or back pain. What are some things that they can do on the job and off the job to kind of release that pain or stress?
I think a great thing to learn is basic upper neck and back stretches, especially for the upper trapezius, for the levator scap. These are some muscles that are very high yield and that are often the culprit for neck and back pain. And even doing exercises such as like a chin tuck, where you try and make a double chin and keep your gaze at the same level, but almost just bring your head back to activate your neck flexors. Because a lot of times when we're working on computers and sitting, our necks will kind of go into extension and drift forward. And to combat this, you should actively try and flex your neck muscles and bring your head back into proper alignment. So I'd say to start, just stretching and realigning your neck are like some of the really easy to do, high yield things that you could accomplish while you're even on the job or in the hospital.
Yeah, I think that's great advice. And is it more prone for people who sit in front of a computer versus maybe somebody who's with patients all day long, like yourself?
Yeah, I would say so, because I'm just moving way more. And whenever I chart, I actually do it standing. So there's very fleeting moments where I am sitting, but I'm always making sure to change position and keep moving. So if you're able to get a standing desk, that would certainly help a lot. And then, because when you're on your computer and sitting, you're always prone to this rounding of the upper back. Your head comes forward to kind of read what's on the screen. So we should always be actively doing things to reverse those effects, such as kind of bringing your shoulders down and back, making sure you have good posture, and even stretching your pectoral muscles that are kind of pulling everything forward helps your posture too.
Well, that's great advice. I think our conversation went somewhere else, but I think that's something that probably helps everybody out there. Cool. How do you like where you live right now, and how is residency life treating you?
I'm living in Philadelphia, and I love it. I grew up in DC, but I think I'll be staying up here for a while. Residency is great, to be honest. I feel like, I'm doing truly what I was meant to do. So work doesn't really seem like too much work because it's really fun for me. So I'm just enjoying doing what I love, and the hours are great because there's no call necessarily, and there's no not a ton of inpatient work. So I'm in clinic pretty much 8 to 5 throughout the week. So the lifestyle is great, and I get to help a lot of patients. So it's really rewarding.
That's fantastic. And yeah, I mean, since I went to training a while back, I think things have changed for the better. A lot of residency training has become less hours, and I think the newer generation of doctors being trained now are interested in having a work-life balance. Do you feel like you have that in training and in medical school right now, or is it still mostly work?
I'd say my training initially was pretty difficult. My intern year was heavy floor medicine for about 10 months, and I was, working about 80 hours a week, 6 to 6, and then 24-hour call every few days. And my mom was telling me that when she was in training, a 36-hour shift was definitely there every week. So she was like, oh, they shortened it to 24, so that's good. But yeah, that first internship was rough, but afterwards my second and third years have been a lot more calm, and I love it.
Oh, okay, fantastic. And what is some advice you would give to people who are looking to just go to get into medicine? They're in college and they're deciding what they want to do. Should they go to medical school? What advice would you give them, since it sounds like you're closer to that than I am? What are you seeing out there? Do you find it as rewarding as you thought it would be?
I absolutely do. And I would say make sure you're choosing medicine for the right reason, because a lot of, in a lot of cultures and areas, people would say, oh, you should either be like a doctor or a lawyer, and that's all your options. And I would make sure that you really want to truly help people, not for the money, not for prestige, but really being a physician is about serving your patients and, helping people's lives. And I would say if that's what you really want to do, go for it. And sometimes you got to just listen to your gut and go with, what you really want. For example, I wanted to do physiotherapy. It's a way more well-known profession and more just, I guess, accepted. It would be easier to explain kind of what I do, but I went through to the OMM residency, which is much less well-known and is way more not traditional, because that's what I truly wanted. So if you're going into medicine, definitely do it if that's what you love, and you can't really go wrong if that's what you do.
I think there may be a lot of people out there that are thinking, should I go to medical school? Should I not? And it's great to hear from people like yourself that find it rewarding on a day-to-day basis. I think things do change when residency ends, and then you basically have to really join the real workforce, or, either find a job or start a practice. And then it might become more challenging, but it becomes more rewarding too, because like you said, you get to go out there and do it on your own, and you get to be more autonomous. So I think it's a little bit scary and exciting at the same time. What about your specialty of OMM? Is there any advice you would give to people who are interested in that and are maybe listening out there to kind of understand better if this is a field they should go into?
Yeah, I would say if you're interested in even just seeing what DOs in your area do manipulation, because to be honest, a lot of DOs, they stop doing their manipulation, after school. So if you want to find a specialist, you could go to doctors.do.com, and you can search for a DO who does it in your area. Also, the American Academy of Osteopathy has a Find a Physician link, so that's another good resource. But yeah, if a lot of pre-meds shadow me in my own clinic, so you can message me on Instagram at dr.alex.king, and we could set something up. Or even if you have a DO school in your area, you could email the school or call them and see if they have an OMM department and try and do shadowing there, or even become a patient if you want to experience it firsthand. Because I think the best way to really feel, what OMM has to offer is to try it and just experience it for yourself. So yeah, that's the advice I would give for anyone who's interested in learning more.
Is there anything else you'd like to share? What you like to do for fun or anything like that?
Yeah, I'd say my hobbies really complement what I do, which is nice, which kind of goes into why you always want to stick with your gut when choosing a specialty in medicine, because, you're going to be doing this for decades and decades, so it should kind of fall in line with your hobbies as well. So, my hobbies include kinesiology, body mechanics, learning even like physical therapy techniques. I just YouTube stuff like that. And I really love to coach like barbell training. So deadlifting, squat, bench press, and I'm a fan of bodybuilding. So I've always been into the human body as a machine and performance. And I love treating athletes as well. So yeah, all my hobbies kind of like relate back to what I do, which, is great because I can learn a new exercise or a stretch and then try it myself and then teach my patients the same thing.
We see on your Instagram that you have a lot of your workouts on there.
Yeah, I'll put a lot of workouts there, and even some that are more advanced, but just so people can see how they can kind of build up from just basic stretches and exercises, and then over time you can achieve some of the more advanced exercises as well. So yeah, I like to post my interests, current things I'm doing. Sometimes I'll post a treatment on there.
Yeah, well, it's nice when you can mesh your passion or your hobby, which is fitness,